There is a symptom that can sometimes go unnoticed, a symptom that shows up right there on your sheets. Yeah, I know early detection of cancer can save lives and make the difference, between a successful treatment and one that becomes very complicated or even ends badly. That is why early detection is so important. But how is it done? So first, through early detection or screening programs for breast cancer, colon cancer, and other cancers, which are being implemented in different countries and regions around the world. And second, by recognizing symptoms such as unexplained weight loss, prolonged fever that does not resolve, or intense and persistent fatigue, sometimes more specific symptoms such as any type of lesion that may appear on the skin, or bleeding from different parts of the body. In reality, our body often gives us more or less subtle signals that something is not working properly, and it is important that we pay attention to these signs before it is too late. But there is a symptom that can sometimes escape our attention, and that is exactly what I want to talk about today. A symptom that appears on your sheets. I'm Dr. Andrew Senemes, and in this video I will cover three things. First, what this symptom is. Second, what its possible causes are. And third, when you should see a doctor. So, what is the sign that may appear between your sheets? It is this. You wake up in the morning to find your sheets or pillow completely soaked with sweat. In other words, you have experienced intense night sweats. Now, this may be completely normal if it is a warm climate, if the temperature is very high, especially in summer, or if you slept with too many blankets. But if it happens without any obvious reason, that is something you need to keep in mind and pay attention to. And why does this matter? Because it can be your body's response to many different circumstances. We have already said it could simply be due to the ambient temperature, but it can also stem from a wide range of causes, from hormonal changes to infections. And what many people do not know is that this can be an early symptom of certain types of cancer. Imagine waking up in the middle of the night with your pajamas completely soaked, not because you had a restless night, not because it was hot in the room where you were sleeping. That is exactly what should catch your attention. So what are the possible causes of excessive night sweats? Let us set aside the obvious causes, like high ambient temperature, and focus on the ones that truly matter. First, let us talk about cancer. Although it is not the first cause we would think of, it must be taken into account, especially when it is associated with other symptoms or signs that I will mention at the end. The first cancer to consider is lymphoma, specifically Hodgkin's lymphoma. This is a cancer that affects lymphocytes, a type of blood cell that is part of the immune system, and it typically affects the lymph nodes. The increased sweating in these cases is caused by certain substances produced by the cancer, which lead to a dysregulation that results in nighttime sweating. Second, there are leukemias, cancers that affect blood cells. In these cases, white blood cells are produced in the bone marrow in excessive quantities, and this can sometimes lead to infections that are also associated with night sweats. Another type of cancer in which this symptom can appear is prostate cancer and also breast cancer. It is also important to note that the treatments used for these conditions, such as chemotherapy or radiation therapy, can cause night sweats, and this effect may persist even after the treatment has ended. There are also other types of tumours that produce hormonal substances and can lead to night sweats. And for example, pheochromocytoma is a tumour of the adrenal glands that produces an excess of adrenaline and noradrenaline. This triggers the classic fight or flight response, one symptom of which is excessive sweating at specific times. The same can happen with carcinoid tumours, which produce excess serotonin and can disrupt body temperature regulation, as well as with thyroid tumours, which produce excess thyroid hormones, accelerating metabolism and causing excessive sweating. Speaking of hormonal causes, hyperthyroidism, even when not caused by a tumour, can also lead to excessive sweating among other symptoms. Menopause is another very common hormonal cause, with episodes of sweating that are typical of this stage of life, even at night, and which can disrupt sleep. Hormonal changes during puberty can also sometimes trigger this phenomenon, as can pregnancy. Another set of causes for night sweats involves infections, which are usually associated with fever. These include pneumonia, tuberculosis, endocarditis, which is an infection of the inner lining of the heart by a bacterium or virus, malaria, infectious mononucleosis, also known as the kissing disease, HIV/AIDS, and Lyme disease, among others. Psychological factors can also be responsible. Generalized anxiety disorder, panic attacks, post-traumatic stress syndrome, and sleep disorders in general can all be associated with night sweats. Hypoglycemia, that is low blood sugar, can also cause sweating, including at night if it occurs during sleep. And this could be related to tumours called insulinomas, prolonged fasting, or most commonly, a diabetic patient whose medication is not properly adjusted, perhaps taking an anti-diabetic medication that is causing hypoglycemia, or using insulin at an incorrect dose. In these cases, the solution is either to investigate the underlying cause or to adjust the medication. Digestive problems can also be a factor, for example, gastroesophageal reflux, where stomach acid passes into the esophagus and causes a burning sensation. This worsens when lying down in bed, and the person will usually have other digestive symptoms that can help identify the cause. Lifestyle factors must also be considered. Obesity, which may have an endocrine cause but is often related to unhealthy habits, as well as smoking, excessive alcohol consumption, and drug use, all of which can produce symptoms of this type. And we must not forget medications. Several medications can cause night sweats, including certain antidepressants, such as serotonin reuptake inhibitors like fluoxetine and paroxetine, antihypertensives such as ARBs like losartan, corticosteroids, and anti-inflammatory analgesics from the ibuprofen, naproxen, and diclofenac family. Thyroid hormone supplements used to treat hypothyroidism can also cause this symptom if taken in excess or improperly. And of course, chemotherapy drugs used to treat cancer can produce night sweats as a side effect. Now, how can excessive night sweats be prevented? If there are no alarm symptoms, which I will discuss in a moment, and serious causes have been ruled out, the first step. So it's simply to sleep in a cool environment, without too many clothes or blankets. Common sense goes a long way. And beyond that, take care of your lifestyle. Avoid alcohol and excessive caffeine. Eliminate tobacco and recreational drugs, and try to maintain a healthy weight. It is also recommended to avoid spicy foods, which have in some cases been linked to excessive sweating. Each person will need to evaluate this for themselves. So, when should you see a doctor about night sweats? As I mentioned, in general, there is no cause for alarm and it is often not a serious problem. But there are certain warning signs that make it important to seek medical attention and to rule out possible cancer, as mentioned, or any of the other conditions discussed. You should consult a doctor when night sweats regularly interrupt your sleep. If your sleep is being disrupted for several days in a row and you are concerned about it, get it checked. You should also consult if, in addition to night sweats, you have associated symptoms such as fever, which clearly warrants a visit, but also cough, diarrhea, or pain in any specific area of the body. Unexplained weight loss combined with night sweats is another important reason to see a doctor, particularly if you are not eating less than usual, and if you are a woman who has been through menopause and the menopause-related symptoms had already resolved, but now you are experiencing night sweats again. This should be evaluated. And if you have already been diagnosed with lymphoma or AIDS and are undergoing treatment, but you start experiencing unexplained night sweats, consult your doctor, as this could indicate disease progression. So to summarise, in most cases night sweats are not a serious issue, but there are certain situations where it is important to consult a doctor and get a proper evaluation. Take care of your health, pay attention to your body's signals, and do not ignore what your sheets are trying to tell you. Thank you very much. Take care, and I will see you in the next video.